Hello, welcome to today's show. Today is April 23rd, 2020, and this is Coronavirus Update by Heerak show. And welcome to my show. I've created this show in order to help you learn more about coronavirus and also the world around you as coronavirus develops, evolves, and proliferates. Yesterday's episode talked about how coronavirus is mutating. So if you're interested in that, you could go check out yesterday's episode. Today, we're going to be talking about New York. New York. I mean, it's center and focus because so many New Yorkers are dying from coronavirus. So obviously, it's newsworthy and it's worth discussing because other major cities can become like New York, Washington, D.C., Philadelphia, Chicago. So it is important to talk about it. So that's what we're going to do a little later on. Before we start talking about the daily death rate, I would like to say Happy World Book Day. Today's April 23rd. It's World Book Day. Obviously, it's been 10 years since that photo, but that's to show you that it's been celebrated yearly for 10 years, and a lot can change in 10 years. Can you imagine what you thought would happen 10 years later in the year 2010? You know how college application essay says, write about what you will be like 10 years from now. I interview high school students who apply to University of Pennsylvania, and I've been doing that over 10 years. And sometimes that's the question I ask. I said, tell me, what are you going to be doing 10 years from now? So 10 years ago, did you think that this would ever happen in your wildest dream? The world can change in a blink of an eye. Literally, that's what happened, right? For many people. And some of you are still saying, oh, is this really happening? Am I in a dream? Is this a reality? Let me pinch myself. There are some of you who may be like that out there. But they say a way to achieve immortality on earth is through books. And that's why a lot of people try to become authors. And publishing industry has grown to be very big, and New York is considered #1 publishing industry. And now everything is kind of shut. So that also reminds us what's going on in New York as well. I'd like to encourage you to read my books, read Heerak's books. As you know, maybe some of you don't, but now you do. I am a writer. So I am the Leonardo da Vinci of the 21st century. And that's why I created this show, because with all my knowledge, experience, insight, and erudition, and formal education, I come to you with perspectives that CNN, Fox News, ABC, NBC, PBS cannot provide you, because there just isn't anybody who have had formal education that I have had by the best and greatest minds in the world alive today. I've studied at Harvard, I've studied at Brown, I've studied at researched at Cambridge University in England, at Heidelberg University in Germany, Regensburg University in Germany, Freiburg University in Germany, UCLA, University of Pennsylvania in America, and in Jerusalem. I studied at Hebrew University of Jerusalem, researched Jewish identities for over 3 years with the best funding and fellowships, research fellowships available. So I've received a formal education. I've done some amazing research, along with and under the guidance of some of the greatest minds in the world today in different fields, different areas, different concentrations, different foci. And I'm currently doing my master's degree at the School of Nursing and Health Studies at Georgetown University, focusing on clinical nurse leader. That's the track that I'm on. I'm due to graduate in the summer 2020 with my cohort members, and I talked a little bit about my cohort yesterday. Hello, fellow cohort members. Everybody's watching my show, so it's I want to just say hello to people that I know, and so I'm doing my master's degree, with a focus in clinical nurse leadership. And, as the title implies, we focus on that. I have expertise in that area. I have a Master of Education in Reading from University of West Georgia in the state of Georgia. Hi, University of West Georgia. Hi, my professors at University of West Georgia and all my fellow classmates who graduated with me. Yeah, so I have expertise in so many different fields. That's why I have created this program to help you. So watch this program every day. Subscribe to my YouTube channel. You're going to get insights in this show that you're not going to get anywhere else. And it's going to help you survive. It's going to help your children survive. So tell your friends, your relatives, parents, adult children, co-workers, neighbors, tell everybody to watch this show religiously, like every day. So I'm going to share some of the books that I've written so you can read it. This is the book called The Korean Soul. The whole book kind of is about exploring Korea, and I'm ethnically Korean. I immigrated from Korea to the United States when my parents came over to America. My dad was invited to be the senior pastor at First Korean Presbyterian Church in Philadelphia. I have a love for my home country or old country. So I wrote this book of poems for others to understand Korea better through my eyes as a poet. There's a little excerpt on the back of my poem regarding my uncle. My mother's brother was shot dead by a stray bullet by a U.S. soldier who was shooting at a paper boy who took his money and did not give him a newspaper. So the stray bullet killed my uncle during Korean War. So I have a piece of poem about that. Obviously, I'm very grateful. My whole family is grateful for our U.S. soldiers who came to Korea to rescue our country during Korean War. But there are things that happened there, that are sad. And my uncle getting killed by a stray bullet is one such story. I have another poetry book that I want to share with you. It's called Limited Atonement. And you could order, my poetry books through Amazon USA, or you could Amazon Deutschland, Amazon United Kingdom, Amazon Australia, Japan, China, wherever you are, you could order through your local Amazon. So you could read my poetry books. So this book is called Limited Atonement, and it has some, it has a lot of poems that I wrote when I was at Cambridge University. I spent 5+ years at Cambridge University doing research into Jewish studies. This is the poetry book that I wrote when I was in Cambridge. You enjoy reading about my experiences in Cambridge. So you can kind of live vicarious through my poetry and kind of see what kind of experiences I had over there. So I hope you will explore some of the writings that I have through my books. And feel free to share that with me. If you go to www.heerakforcongress.com, you see the website in your screen right there. There's a way for you to send me your messages via email or through letters, and so just let me know what you think. I'm curious what other people think about it, but hopefully these books will help you during this COVID-19 stay at home reality for you to read something new, to learn more about experience in Cambridge, England, or South Korea. So I wanted to shout out to my friends from Cambridge, England. I made a lot of friends in England through my Cambridge University days. And some of them are important leaders in England, Scotland, Wales, and Northern Ireland right now. So I want to do a shout out, hello to my friends and classmates from Cambridge University, those who research with me. So there were some amazing researchers there. And obviously, I want to say hello to people in Korea, my relatives in Korea, and my friends in Korea. I went to up to fourth grade elementary school in Korea before immigrating to America. So some of my friends there are in leadership roles now in South Korea. And so, yeah, so today is a World Book Day. And you're probably reading more books now, and this is good time for you to read. I would say the Bible is the best thing to read. If you haven't read the Bible, it's the greatest book. So I actually would plug the Bible the most. Everybody should read it at least once, and then draw their own conclusions about it. But yeah, if you haven't read the Bible once through, I would encourage you to do that during COVID-19. So let's go to our death numbers. I hate to say I told you so, but I told you so. If you see earlier episodes, we broke the 3,000 death per day rate this week. And I was saying that we're probably going to do that again. And maybe that is a new reality because we have 50 states and death rates are rising. I'm in Virginia and I'm coming to you live right now, at least. You'll probably see a recording of this, but I'm coming to you live from Arlington, Virginia, which is turning out to be, Arlington, Alexandria, Falls Church, and Fairfax County. The Northern Virginia region is turning out to be the epicenter of Virginia. So maybe in a few weeks, we're going to see tremendous number of people dying in this area as death rate grows. Hopefully, we don't become like New York. And that's one of the reasons why I want to talk about New York, because if we could prevent anything from happening here, that's like New York, let's do it, and in nursing, we call that primary prevention. Primary prevention is you do everything you can to stop yourself from having a disease. So let's say you're overweight. Primary prevention is exercising and eating less food, dieting, in order not to develop diabetes. Because if you're overweight, generally that becomes diabetes, and they call diabetes a slow killer. When I was working at the orthopedics unit at MedStar Hospital, Georgetown University Hospital, I worked with a lot of people who had their leg, toes, and feet amputated, cut off, because they had diabetes, and it was uncontrolled. So that's why they call diabetes a slow killer. Um, um, And so, so that's what primary prevention is, stopping things before it happens. And so we're going to talk a little bit about that later. But let's go back to our daily death rate. We have 3,221 people who died within 24-hour period in the United States of America. Death rate is going up, and it's going to continue to go up because death rate in Virginia is going up. Death rate in Washington, D.C., right, which is right next to Arlington, is going up. Death rate in Maryland is going up. So just looking at this region where I am, death rate is going up. And if that's happening in every other state, of course, the number of deaths will go up. Total number of deaths in the U.S. will go up. So we may even hit an average of over 4,000 deaths next week, or 5,000 deaths. So numbers are going up, and that's why I'm predicting by August 2020, 1 million or more Americans will be killed by COVID, just because we're doing the math and we look at the numbers go up. Virginia, Washington, D.C., and Maryland is nowhere close to the peak. And there's, increasing number of people dying. So once, we're near the peak, we're going to see tremendous number of people dying. So, and Mayor Bowser said earlier that it may be in June when we hit the peak. We don't know. That was one of our theories earlier. But let's say it hits in the peak in June, we have like what, month and a half or 2 months before we hit the peak. So by June, we may have, 7,000 people dying per day. I mean, we don't know because we're talking about 50 states, and every state has death rate rising generally. And some of the states will hit the peak July or August, so different states are at different trajectory. So, but it doesn't seem like New York is coming down anytime soon. But before going to New York, let's just look at the death numbers here. So total number of deaths in the U.S. yesterday was 46,640. Today is 49,861. So we're about to break the 50,000 people dead mark. I mean, it's just going at a tremendous rate right now. Confirmed cases are about the same, rising around 30,000. Um, it was at 840,897 yesterday. Today, it is at 868,395. So just imagine if we have 3,000 people dying every day. In 5 days, we have 15,000 people dead. In 10 days, we have 30,000 people dead. So do you see how that works? Yeah. Let's look at New York. Number one death is New York City. It keeps going up. It's at 20,973 deaths. Nassau County, which is close to New York City, it has 1,471 deaths. Suffolk County has 959 deaths. That's third place. Fourth place is Westchester County, where Mark Zuckerberg grew up, where many of his friends and relatives still are. It's 863 deaths. Maybe some of his relatives already died over there. Rockland County is number 5 at 436 deaths. I actually owned a learning center in Rockland County, right near, less than a few miles away from New York City, close to Manhattan. I started it from scratch, and I ran it for several years. Learning center, it had a success rate of over 90% of students who came, they hit their target goal. So we were the best learning center in the area. And so I'm very proud of what we have accomplished. A lot of important leaders are coming out from there. In the next 20 years, you'll see them in very high leadership places. We've done some amazing things. Like there were students who had autism or attention deficit hyperactive disorder, bipolar disorder, all these different kind of disorder. They came to me and I helped them, and many of them were flunking or at the bottom of their classes in every subject, and I was able to bring them up to first or second rank. We perform miracles at the Learning Center. I told you I'm the Leonardo da Vinci of my generation. If you have a child who's like autistic or ADHD and they're failing in school, you bring them to me. In less than a month, month or two, they'll be at the top of their class. When I was working with this one student at Savoy Elementary School as a reading specialist, as I told you, I have my master's of education in reading specialty as a reading expert, reading specialist from University of West Georgia in Georgia, which is part of the Georgia State University system. I privately tutored this one student as a part of my master's kind of a capstone project, practicum. And so I took the student who had the worst performing grade in English language arts from the standardized testing. Like the student was at the bottom, like the lowest, was reading, literally, he was a 5th grade student. He was reading at 2nd grade level because I did all the assessment to assess his reading level. And obviously he had the standardized test that also said he was at 2nd grade level. So he's a 5th grader. His reading was like at 2nd, maybe even late 1st grade level. And we're talking about time you're learning about phonemics, hooked on phonics, kind of, that level, right? I mean, so, I was working with the student. And you know, it's considered a hopeless case. I mean, my colleague at Savoy Elementary School, who was his homeroom teacher, wanted to track him into special education. So he actually had RTI, which is like one step before being tracked into special education. And from what I learned from my master's of education program at University of West Georgia, and we focused on improving reading for students who have problem reading and students with special needs, less with special education children. So that became my specialty because it was like a 2-year master's program, and I graduated with 4.0 straight A's. Was top of my class, summa cum laude. So you know, I'm very good in reading specialty education. You know, you know, so I took this student. I said, this is not a special education case. I mean, he doesn't have you know, intellectual disability. He doesn't have mental retardation, with, you know, kind of quote mental retardation. He does have behavioral issues, you know. So some special educations become special education because of their emotional needs. So I could see why the teacher tried to track him into special education from that angle. But you know, I am of the school where if you don't have to put a student into special education, don't put him in special education. You know, obviously there are students who need to be in special education, and we should definitely help them. But if the student doesn't need to be in special education, don't put him in special education. You know, especially 5th grade, because if he gets tracked into special education, you know, in most school districts, he's not going to go to regular classes. And so, you know, in my opinion and my expert diagnosis, because, you know, by the time you're doing practicum, you know the subject, you know the field pretty well. In my expert opinion, he should not be tracked into special education. I opposed his homeroom teacher tracking him into special education. I don't know. Hopefully you don't hate me because of that if you're watching this show. But you know, I believe that he should not be in special education. So I tutored him for a couple months, and I used methodologies that I learned from University of West Georgia, as well as the methodology I had at Learning Center that I started and I ran as CEO, Chief Executive Officer in Rockland County. And in 2 months, he achieved the highest score on the standardized examination given by District of Columbia Public Schools to all the District of Columbia Public School 5th graders. So benchmark assessment given by DCPS, District of Columbia Public Schools, to all of its 5th graders. He achieved the highest grade on that objective. It's a multiple choice test in 2 months. And he had the highest score in his class. Think about how good I am. I mean, I hate to blow my own horn, but the truth is the truth. Reality is the reality. I took the worst performing 5th grade student at Savoy Elementary School in Anacostia neighborhood, Ward 8 of District of Columbia. The worst performing student in his whole class, who had been given up by his teachers from 2nd, 3rd, 4th, 5th grade. And I tutored him for 2 months, one-to-one, using my expert skills that I acquired from University of West Georgia in the Master of Education Reading Specialist program, and also some knowledge that I had from running the Learning Center in Rockland County, New York. And he, in 2 months, in the benchmark test, objective test, got the highest score in his class. That's a miracle. Think about what I can do with every student in his shoes. That's why I am the Leonardo da Vinci of 21st century. And lucky for you, lucky for urban public schools throughout the United States of America, I am conducting research right now to be published hopefully in the nearby future to solve the problem of urban public school education. Because you need people like me who is Renaissance man, you know, Leonardo da Vinci to solve it. Obviously, there are problems that ordinary people cannot solve, and I'm extraordinary. I'm the Leonardo da Vinci of my generation, not only my generation, the whole 21st century. So there are problems that mere mortals could not solve for generations, thousands of doctoral dissertations that I can solve. So I'm working on that. So lucky for you, all the public school systems throughout the United States of America that are urban, look at the miracle that I will be doing for all of you. And this book is coming soon. So yes, this is the kind of thing I do in my free time. I try to solve world's problems. I'm like the Spider-Man of solving social problems, world problems of the world. You know, I use my brain to solve the problem. Pen is mightier than the sword, right? So yes, the public school systems throughout the United States of America is something to look forward to, a solution to the problem that has evaded them for over 50 years. Yes, I heard the key. I presented my paper at Kappa Delta Pi, which is the International Honor Society for Education. And they had their annual conference in Norfolk, Virginia in 2019. So I presented my findings there and I received a lot of adulation and praise. And so I presented part of my research there. And so, yeah, and I'm not just good at reading specialist. You know, I'm a co-chair of the program committee of Virginia Council of Teachers of Mathematics. We try to upgrade math education in Virginia from pre-kindergarten to PhD programs in education. You know, so professors at University of Virginia, College of William and Mary, Virginia Commonwealth University, they're all part of Virginia Council of Teachers of Mathematics. In fact, my co-chair is a professor of mathematics at George Mason University. She's taught there for over like 15 years, mathematics education. Yeah, so that's my co-chair. Yeah, so you see what I am doing for you. Yes, I'm here trying to solve COVID-19 problem to help people in Virginia's 8th district survive COVID-19. Yes, I mean, since I am the Renaissance man who is an expert in many different fields, well, I confine myself to the little field of education, right? So that's why I created this show to save your life and the lives of your children. And that's why you need to watch this show every day religiously and tell your friends, family members, course to watch this show. Because if I can't solve the problem, probably no one can. So I'm the Renaissance man. So yeah, they call me the problem solver. Yeah, so this guy, my student, well, he was in my homeroom, but you know, I taught him as well. But you know, his homeroom teacher, get this, started to use him as a peer tutor in reading. Yes, that actually happened. Yes. So the student who had the worst achieving score in reading was the least performing student in English language arts. I took him, tutored him for 2 months, became the #1 student in reading in his class. His reading level from 1st grade, 2nd grade went up to 5th grade in 2 months when I tutored him one-to-one as part of my practicum, which is like the master's degree in education, you know, final project kind of thing. He became #1. I mean, how many people can say that? I mean, I call out to all the reading specialists throughout the United States of America. You know, as you know, as I shared in my previous shows, I do literacy advocacy in Washington, D.C. every year with National Council of Teachers of English. This year we can't do it because of COVID. I did it last year. I did it the year before that. So, you know, as someone from Virginia, I visited Senator Kane, Senator Warren, and the guy that I'm running against, Don Byer's office, to advocate for literacy for the past 2 years. Yeah. So I work with literacy experts also at the policy level to pass legislation that will advance literacy. But I assure you, there's only one of me. Yes, miracle worker, the problem solver. And that's why you're lucky that I'm in Virginia's 8th district. That's why you should vote for me on November 3rd, 2020 in the general election. I'm running as an independent candidate for U.S. Congress in Virginia's 8th district, Arlington, Alexandria, Falls Church, and Fairfax County. I will solve problems that you didn't even know existed. Yes, that's me. Yeah, so vote for me. Don Byron seems like a nice guy. I met him. But I believe I will do a better job and I'll be a better leader for you. That's why I'm running. I'm running to be your leader. And obviously, I'm being your leader now by providing this information and program and knowledge. I'm your leader now, providing this information to you. So I'm already your leader. I'm just asking you to make me your formal U.S. Congressman. I voted for me on November 3rd, 2020. Now, the flag on top is New York State flag, for those you did not know. We're going to go on to talk about New York. And who better to give us a matrix of discussion than the leader leading New York State? None other than New York Governor Andrew Cuomo. I enjoy watching his, show. I'm sure he's watching my show too, because I could see that he's adjusting some of his daily talks based on my show. Like, for example, like I have this show now. His talk tomorrow will be adjusted based on this show. That proves he's watching my show fairly religiously. Why would you not watch my show? I'm the Leonardo da Vinci of my generation, not just my generation, of 21st century. Everybody in the world should be watching my show. President Trump, Prime Minister Boris in United Kingdom, Angela Merkel in Germany. Everyone should be watching my show throughout the United States, because I give you ideas that some of your brightest minds can't even begin to fathom. And obviously, I thank God for His gift, and also the formal education I received from the greatest minds in England, United States, Israel, Germany, France. So they have given me an insight and a level of critical thinking that is not achieved by most mortals. So I do give them credit. Now let's talk about New York Governor Andrew Cuomo. How will he be remembered in history? I am professionally trained as a historian at UCLA. I'm the treasurer of the UCLA Alumni Association in Washington, D.C., or UCLA Network. So I work closely with leadership of UCLA and also of University of California, District of Columbia, UCDC, that's in Rhode Island Avenue. So UCLA trained me as a historian. University of Pennsylvania trained me as a historian as well. I did my bachelor's in history at University of Pennsylvania, cum laude, and then I went to UCLA for PhD at the age of 20. So I was professionally trained as a historian at UCLA in the PhD program there. So I always look at things from the historical perspective. How will you be remembered in history? How will I be remembered in history? These are important things to me to ask, because things change rapidly. But in the long term, how you remember the history is what really counts in terms of your legacy, right? And some people are completely forgotten. There are leaders, presidents, kings who are completely forgotten. They're not remembered in history at all. Some say it's better to be remembered negatively than not be remembered at all. I mean, you may have some opinions of that. But with New York Governor Andrew Cuomo, my question is, how will he be remembered? And obviously, it's hard to say right now because everything is evolving and changing. And you see Governor Cuomo with his worried face there above the photo of New York Albany Capitol building. And it says, I love New York. Well, I don't know how many people are saying that now, right now, with all those New Yorkers dying of COVID. But so I have 3 articles which we can use to discuss, Professor. Uh, so I'm kind of taking a role of a professor here in a way. So you're kind of getting a mini college seminar on Andrew Cuomo. So in a typical international relations, political science, history class, where a historical figure is discussed or political figure is discussed, they bring in documents to discuss the figure. And so I'm bringing in 3 different documents as a jumping off point to discuss a political figure. So that's what they do in colleges, you know. So if I ever teach at Georgetown University in School of Foreign Service, diplomacy classes, or in the history department, this is the way some of my classes would go. And I assure you, Georgetown's undergraduate students would love me as their professor. When I was teaching at UCLA, oh my gosh, so many students loved me. It was emotionally draining because every office hour, literally, there was a line in the hallway. Yes. So when I was teaching at UCLA, I was so popular as a professor, teacher there, that people would come to me and say, can you please put me into your class? So I'm maxed out at 20, right? And there are like dozens of students wanting to get into my class because I am a legend, at UCLA, proving a great teacher with great inspiration, right? So I can only sign 5 people in because that's class is already closed. I have my authorization to let 5 more people in. And I'm looking at the sad faces, dozens of sad faces wanting to get into my classroom. So I always generally let 5 more in. Most of my friends won't because that's just more work for you, right? For same pay. But I'm like, I don't care about money. I want to help and I want to educate and so I let as many as possible in, and then during my office hours, you have like dozens of people lined up, literally in the hallway. And other people who are teaching, they're like, what's going on, Heerak? What's going on? But yeah, I have that effect, my students love me. They just, they not only love me and adore me, they worship me. Yeah. I mean, I had students ask me to write down recommendations to medical schools, and I'm like, why can't you ask your biology professor to write you recommendations to medical school? I taught you history, and yeah, I'm always happy to write recommendations, and I always write good things. I never write bad things, even when they have a lot of weaknesses. I just focus on the good things because you're talking about their life, their future. I'm not going to mess up somebody's life. Geez, they're college students trying to get into med school. Why don't I see helping them as the most important thing. I have some colleagues who are like, you have to tell the truth. You have to tell exactly what happened. So if they have weaknesses, you got to mention that. And, I'm like, what? Every human being has errors. Everybody has weaknesses. We're talking about a person's whole future here. Why would you want to mess with somebody's future? Doesn't make sense to me. It just doesn't seem ethical. So, I just focus on the positives. There are enough downers and, haters in the world. Well, I don't need to add to all the negativity. I don't need to add to destroying the student's self-confidence and hope for the future. I taught this student. I am his or her teacher. I'm going to see to it that he or she succeeds. I'm going to open doors as much as I can. That's how I see myself as a teacher. And so But, I don't say that to my students. And I'm one of the toughest teachers. You could ask any of my students. I mean, I am a pretty tough teacher, but I generally gave as many good grades as possible just because I don't want their future to be messed up. So I worked them. I worked them a lot, but I generally gave everybody like A's and B's because I don't want them to get rejected to graduate schools. I had friends in the department who used to give like 1A, 1A, 1A out of like 20 students, and then like 6 B's, and then like 10 C's, and then like D's, and they would even flunk students. I'm like, what? Why would you want to do that? I mean, geez, if the student has some area the student needs, work with the student, I mean, don't flunk the student. Geez. I mean, yeah, but there are people who kind of go on power trips, and as professors, and it's sad. I mean, you're there to help people learn and become better, contribute to society. If they have weaknesses, you're there to help them. You don't take things out on your students, and you don't try to ruin their lives. I mean, it doesn't make sense. So, but anyway, I love all my students. I try to help them. And so, like this would be how I would teach a seminar, and this is the kind of method I used when I was teaching at UCLA as well. And so the first article is Cuomo plans to use National Guard to seize ventilators from upstate facilities, and that was in Politico April 3rd, and maybe it was during his moment of desperation. The quote is, "Right now the numbers in upstate New York are lighter than the numbers in downstate New York, but that is going to change," Cuomo said. "You're going to see that wave move through the state. We're going to shift resources all across the state to whatever place has the need at that time." So Cuomo was going to use the military to seize ventilators from hospitals in upstate New York. So I don't know. He seems to have a little bit of a, shall I say, despotic streak. I mean, my gosh. I mean, nothing like volunteering. I would never do that because I mean he's predicting coronavirus will go up to upstate New York, right? He's saying that right there. And you see in print. How can you take away ventilators from hospitals in upstate New York, knowing that this deadly disease is going to go there sooner or later? See, I just think that that's unethical. Governor Cuomo, I like you. You seem like a likable guy, but I would say what you propose doing there on April 3rd is highly unethical because you're not only stealing from a hospital in upstate New York that may need ventilators, not just for COVID patients, but for maybe patients who have heart attacks or respiratory problems. There's still flu going around. I suffered a lot from influenza A. I didn't need a respirator. I recovered at home, but there are people who need respirators, pneumonia patients, and you can't take ventilators away from hospitals. They need them, And you're saying right there that you anticipate COVID-19 going up there to upstate New York. So how can you take the ventilators away? I mean, let's say you take the ventilators and bring it down to New York City. Do you think COVID cases in New York will die out before COVID cases hit upstate New York? Now you've taken all these ventilators from hospitals in upstate New York. They're being used with patients in New York City. And cases going on and on. And then upstate New York now has a lot of people dying, like 1,000 people dying. They need ventilators, but now they're going to die right away without ventilators because you took them by using the National Guard, military. You're using military to steal private property from other hospitals. I mean, geez, do you see why I respect President Trump? President Trump has acted as a Democratic leader every step of the way. He wanted to quarantine New York State because I mean, crazies are crazy in New York. And I actually honestly think that he should have quarantined New York because I think that would have saved many, many lives in New Jersey and Pennsylvania, uh, and Connecticut. But, we remember you, Governor Cuomo, telling President Trump not to quarantine New York, and President Trump has a democratic leadership. The model of leadership he practices democratic leadership. So he was willing to defer to your suggestion and not quarantine New York. This is why I respect President Trump, because he actually is, his leadership style is a democratic leadership style. He's not an authoritarian leader. He consults and then he makes a decision, and generally he tries to go with decisions that are beneficial to the country or decisions that the governors want. And you as governor did not want quarantine, so President Trump did not institute quarantine. So yeah, President Trump gets bad rap. A lot of haters out there against President Trump. That's just unfair. You examine his leadership style, it's been consistently democratic leadership. You may not agree with his decisions, but that's his style of leadership. He consults people. And look at this. I mean, geez, Governor Cuomo, you're threatening to use the National Guard, the military, to steal private property from people who will need that to save their own lives in a few months. Is that fair? I mean, you can't return these ventilators in a couple of months when New York still has a lot of people dying and may even increase the number of daily deaths. That means you're basically sentencing upstate New Yorkers to death. I mean, it's like Nero. Yes, let's go to the next article. Governor Cuomo says it's not our job to provide PPE to nursing homes. And that was in your post from yesterday. Let me just read the title once again, in case you like say, what? Did Heerak read it correctly? So I'm just going to read it again. So Governor Cuomo says it's not our job to provide PPE to nursing homes. Yes, we need a moment of silence to reflect on that statement. It's not the government's job to provide PPE to nursing homes. And you know how many people from nursing home are dying in New York? And to make matters worse, in the same article, it highlights the policy of Governor Cuomo, forcing nursing homes to readmit residents who test positive with COVID virus. So let's say nursing home has 100 people and no one has COVID. One person leaves, is diagnosed with COVID, and wants to come back to the nursing home with 100 people. Governor Cuomo is saying, by law, you have to admit that COVID-19 patient to the nursing home where 100 vulnerable or 99 vulnerable or older adults are there. Because that nursing home has to admit that COVID-19 positive patient by law passed by Governor Cuomo, now you could have all 100 die from COVID-19. This is a highly infectious disease. It's not like it's a broken bone. It's not like an amputation, right? We're talking about a highly infectious disease, COVID-19. And Governor Cuomo is like saying every nursing home must admit residents who are officially diagnosed with COVID-19. How is that controlling the spread of COVID? How is that reducing the spread? That's like a death sentence to 99 patients who don't have COVID in that same facility, nursing home. Just read the quote from the article. Cuomo's health commissioner, Dr. Howard Zucker, on Wednesday. And which Wednesday is that? That was yesterday, Wednesday, April 22nd, 2020. Defended the state's policy, Andrew Cuomo's policy of requiring nursing homes to readmit residents who've tested positive for coronavirus and also not deny admission to new residents with the disease. New residents with the disease. So let's say some bad son discovers that his mother has COVID-19. His 90-year-old mother has COVID-19. Instead of taking her to the hospital or taking care of her at home, he brings him to the nearby nursing home, drops her off, and says, I want your nursing home to take care of my mother who has COVID-19. She becomes a new resident with COVID-19 in that nursing home until this bad son's mother was admitted to that nursing home. 100 people in that nursing home did not have COVID, but this COVID-19 patient becomes a new admission to the nursing home. Now, 100 nursing home residents who didn't have COVID are going to get COVID, and most of them are going to die because they're all that have pre-existing conditions. Now, is this the decision of a rational mind? I mean, why would you admit a person newly diagnosed with COVID in a nursing home where there's no COVID-infected patients? Now, are you surprised that there are all these outbreaks in New York? I mean, logically speaking, if you're going to put an infected person with highly infectious disease in an environment which doesn't have COVID, logically, everybody's going to get infected. The residents, the workers. Do you see what's happening with these Democratic governors? This is why I would never vote for Democrats. They're just, besides the fact that I oppose abortion and gay marriage, and I've talked about this, and I've talked about this in Alexandria GOP meetings and Arlington GOP meetings as an official candidate for the Republican primaries. I wasn't able to raise enough money to run as a Republican primary candidate by the deadline. I've talked about this in my previous shows. That's why I'm running as an independent for U.S. Congress in Virginia's 8th District. I'm doing my master's degree in the School of Nursing and Health Studies in the program Clinical Nurse Leader for 2 years, full time, including summers. And so I'm borrowing $100,000 per year. So $200,000 over 2-year period. So I don't have any money. I want to save lives, and sometimes, getting the best education costs money. So I could not personally, pay for the registration fee to run as a Republican primary candidate. My other fellow candidates, I believe they didn't get enough donations either, but they had money from their savings or whatever to pay for the registration fee out of their own pocket. So that's what I'm understanding happened. But anyway, this is why I oppose the Democratic Party. They make very irrational decisions, and your true self comes out during crisis like COVID-19. So, these kind of, I would say these kind of irrational decisions, why would you want to introduce infected person into an environment of a lot of vulnerable people? If I were the New York governor, I'm trying to be U.S. Congressman in Virginia's 8th District, what I would do is set up a separate building just for COVID-19 patients where, if the bad son with COVID-19 mother comes, instead of putting that COVID-19 mother in a nursing home where there's no COVID-19 patients, thereby basically sentencing them to death, set up separate, units. I mean, you could use different buildings, public schools, so they're not being used now, or colleges, state colleges, whatever. You can use these buildings to set up just for nursing residents who may not need hospital care. So you create these larger facilities. So let's say a person comes and says, my mother has COVID. We want you to admit the mother into the nursing home. The nursing home could say, well, you cannot admit your mother here because we need to protect the safety and health of our nursing 100 residents. But Governor Cuomo has set up a place where COVID-19 patients can go to receive nursing home care. So you can go there. So you see what I'm saying? If Governor Cuomo is serious about minimizing the spread of COVID, then that's what he would be doing. Maybe he should talk less on TV and do a little bit more on the ground to reduce the spread of COVID. Because, see, there is a reason why over 20,000 New Yorkers have died. It's because of policies like this that spread COVID-19 among old people who have pre-existing conditions in nursing homes. I mean, is this a rational decision? I mean, how would you feel if your mother is in a nursing home and no one has COVID now, but someone comes in and gives her COVID and she dies next week? That could happen to your mother if your mother is in a nursing home. And you know what Governor Cuomo says right now? In this article, you could read it. He said, I wouldn't bring my mother to a nursing home right now. He has no empathy. He has no empathy. This wealthy governor from New York has no empathy for poor people, working class people who often use Medicaid to admit their parents to nursing homes because they can't take care of their parents. They don't know what to do. Instead of coming up with creative ideas to provide quarantine spaces for COVID-19 patients so that they don't spread it to any other vulnerable people, look at what New York Governor Cuomo and his state government, Democratic controlled government, is doing. They're by law forcing every nursing home to accept new COVID patients. Does that sound like quarantine to you? We're not talking about like common cold here. I mean, older people can die from common cold as well. We're talking about highly infectious disease that kills perfectly healthy people without any pre-existing conditions. So why give this death sentence? See, I don't know, it sounds more like a Nero kind of thing to do. What do you think? I mean, you're a thinking person. You see this evidence. Let's say you're in my history class and I say, give me your perception of New York Governor Andrew Cuomo in few words. Like if you were to give him a title, what would you call him? Reading these documentations of evidence that is showing what he is actually doing as a governor. Is it right for Governor Cuomo says, it's not my job to give PPEs? Whose job is it then? What's your opinion? Do you think Democratic Governor Northam can say, it's not my job to provide PPEs to nursing homes? If nursing home people die of COVID because they don't have PPE, tough luck. It's their fault that they didn't get PPEs. That's what Governor Cuomo is saying. I wash my hands of their death, like Pilate did with Jesus. I wash my hand of their death. Is that the right thing to do? What do you think? Is that an ethical thing to do? What do you think? Those of you who are in New York, you should write to Governor Cuomo about this. I mean, what is the right thing for a government to do in a time of crisis? Should we sentence vulnerable population to death by introducing someone with COVID-19 into a facility that doesn't have any COVID-19? Is that an ethical thing to do? It's like mini concentration camps in New York. These nursing homes are becoming mini concentration camps because Governor Cuomo wants to introduce COVID-19 patient into perfectly safe areas, thereby killing everybody. What is that? How would you call that? I'm just asking you because you're a thinking person and you can answer this, right? And let's read a third article. Governor Cuomo says Bloomberg will fund 10 million tri-state area contact tracing network with Johns Hopkins. And you know what he said today? I saw a show today on April 23rd. Yesterday in the Business Insider, that was the reporting, right? He said today, how are we going to really trace 2 million people who've been exposed to COVID in New York? So Governor Cuomo admitted today in his show that he doesn't see this contact tracing being really effective. I'm like, what? I mean, so, you kind of get the opinion, like maybe your Governor Andrew Cuomo needs to change people who work for him. Because either they're not giving him good advice, or he's so overwhelmed by COVID-19, he's kind of going through a type of mental breakdown, and he's not thinking clearly. I'm not sure. Something is going on there. But, I mean, if he has $10 million, he could probably start a quarantine area for older adults, for those who are newly diagnosed with COVID-19, right? And then the whole building will be COVID-19, so everybody who's working there will specialize and be experts on that. Whereas like nursing homes, they may have people who are taking care of other needs, kidney needs, liver needs, cancer survivors. There are other patients with other needs that nursing homes have been taking care of, so they will continue to do that. But you've quarantined COVID-19 patients somewhere else with experts of COVID-19, so everybody's getting the best treatment possible in COVID-19. Do you see what I'm saying? This is why you need to vote for me for U.S. Congress and Virginia's 8th District, because Democrats don't seem to have clarity on how to reduce the spread. And your Governor Andrew Cuomo is a good example. He's a likable guy, but look at this. Look at the evidence. We have to deal with evidence. And these evidence is what defines you, right? And this is the evidence. What's your opinion? I mean, I don't want to put thoughts into your mind. Well, actually, I kind of put some thoughts into your mind and that's how it is. Every class, in every college, the professor is putting some thoughts into your mind. Obviously, hopefully, you're critical enough to push back on some ideas that you disagree with, and that's why we call critical thinking, right, in history classes. So, I mean, feel free to disagree with me, right, but using the evidence. Draw your own conclusions using the evidence. And you can find more evidence, and that's called research. You could read more about Governor Cuomo and what he's doing in COVID-19 and form your own opinion. So see this as an exercise in historical critical thinking. And I hope you learned a lot from today's show. See what I bring you through my show, COVID-19 Update by Heerak. Watch every day. You're going to become more erudite. It's interesting, right? And it's relevant because this is what can happen in Maryland. Although I doubt it because Larry Hogan is a Republican. This is what can happen in Virginia with Ralph Northam. Although he's been kind of smart about it so far, we don't know what's going to happen. But we don't know what's going to happen in Washington, D.C. with Mayor Bowser. And she's actually a pretty clever woman as well. But I'm just saying, you need a reference point so that this doesn't happen in your state, right? If you think that it's wrong. So this is why my show is important. I give a reference point to all 50 states, United States citizens who have their parents in nursing homes. What kind of policies do you want? If you're in Virginia, You could try to find out if Virginia has the same law, because we do have a Democratic governor. So you could do that research if you have mother or father in a nursing home. I mean, obviously, it's important for you to do, because we have outbreaks in Virginia nursing homes right now. In Henrico, there's like 5 in Fairfax County area. I mean, so yeah, so maybe you should be asking these questions. Well, I hope you enjoyed my show, and I hope this show will, give you more information that will be more relevant to your life. And it's practical information, not like theoretical research, like how many angels can dance on the top of a pin, but knowledge that you can actually use to save lives, your loved ones, like your mother and father in nursing homes. So don't forget to watch my show religiously. And this show will save your life of your parents in nursing homes, lives of your children. So keep watching every day. Tell your friends, relatives, parents to watch every day. And this is a public service that I'm giving to you. And this is probably the most important treasure you will have during COVID-19. I hope you will stay safe and that you will be well, you and your family.